The most news in the morning. CNN's American Morning. Monday morning, 6 a.m. Eastern.
Healthcare reform is a topic that's being debated from the living room to the Oval Office. So what changes can you expect in this new year, and what should you keep an eye out for? Still with us, clinical psychologist Jeff Gardier, and joining us is Andrew Rubin. He is the Vice President for Medical Center Clinical Affairs at the NYU Langone Medical Center. Andrew is also the host of Healthcare Connect on Sirius XM Doctor Radio. Welcome both. You know, Andrew, you and I have talked so much about open enrollment and how it's changing this year. I mean, I think a lot of people out there are really worried about their health care in 2010. What would you tell them?
I would tell them to save a little money because they're going to have higher co-payments, higher co-insurance amounts, as we've been talking all about during open enrollment season, and be prepared to have some higher, medical bills that you're going to have to pay for out of pocket.
So it's all about what's in your wallet next year, not necessarily what your employer is doing for you. Jeff, I want to turn to you because you say it's all about preventative care. What do you mean?
Well, absolutely. So many people pay these very high insurance premiums because they're afraid something catastrophic may happen. It's not about the day-to-day doctor's visits or visits for their kids, which they end up paying out of pocket anyway for their favorite doctors. So I think if you spent more time on taking care of yourself physically, emotionally, but especially physically, working out, doing exercises at home and so on, it might take off some of that pressure that you have to pay that insurance, have that insurance, making sure that it's in place, and taking care of what you need to do right now, which is staying away from the doctor.
Staying away from the doctor, that's always, I guess that's good advice if you're healthy and you keep yourself healthy by working out.
That's right.
You know, one of the questions out there, Andrew, I think is, how are we going to end up paying for all of this? Is this ultimately going to come back to me in higher taxes? What's your outlook for healthcare costs overall?
Well, listen, healthcare costs in the near term are going to go up because we're going to be insuring a lot more Americans out there, and the cost control provisions are going to take some time to get under control. We have to figure out where we're going to find the costs to cut. And taxes there'll be more taxes, fees, assessments, whatever you want to call them. They don't start, until the future, a couple years out, down the road. So I would say in the short term, higher costs, longer term, hopefully lower costs. If we can't get costs down, we're going to have a big problem in this country.
I was really hoping for a silver lining here. Is there a silver lining, Andrew?
I actually do think there's a...
For sure. Yes. Andrew, Jeff, thank you so much.
Thank you.
Good to be here.
Your number one investment, your home. So what can we expect from the real estate market this year? We'll tell you next.